And a couple of tips I just wanted to share with you. And of course, there's lots of tips, but I just wanted to kind of throw 6 out there. Our isometrics clinically are overlooked and underutilized. And you need to not just look at the research, but also, or the comments on the research. It's also important to look clinically, what's happening with you, with your patient. And clinically, isometrics definitely do seem to help in the early stages, not necessarily in the middle to late stages. But see if you can gauge an improvement if you are a clinician and you're working specifically with an athlete. They can be really great for reducing pain in those early stages. Use neuroplasticity. So we call it external pacing. So I explained to you about a mirror or visual feedback or video, but other things you can do is like getting them to exercise to a metronome. And this type of concentration gets that motor cortex to fire, which has been shown to be very beneficial. What the athlete shouldn't be doing is doing their rehab in front of a television or an iPad or watching Netflix, because they're not concentrating on that exercise at all, and so they're not getting any neuroplastic benefit. If your athlete flares from an exercise, don't panic. You don't need to completely discard that exercise. Remember, it might just have been too much load too soon. So either reduce the load or bank that exercise and revisit it in a little bit of time. The body loves to move and be loaded in a healthy way. So the body, let's try not to move, stop the body from moving. Let's encourage the athletes to move. And splinting and guarding is damaging. So we don't want people to splint, brace, breath hold, go into spasm as a protective mechanism, often because they're fearful and they haven't really been educated. So remind the athlete that the body loves to move in a positive and healthy way, and that's what we want to encourage. We also get older athletes, as you know, so we get 50 plus competing in tennis or mountain biking or road racing, or obviously multitude of sports. And, as you get older, you do get stiffer and you do end up having quite a lot of pain in different areas just because of wear and tear and degenerative changes. And some older athletes just need to know that having some sort of pain is okay and is age appropriate. So sometimes if there is pain and it's not getting worse, then carry on. To get a 50-year-old athlete pain-free might be extremely challenging. But if they understand that a low level of pain is okay, then they often relax about it and become less sort of concerned or negative about those issues. And so I often use that carry on type of thing. So if you don't have an increase in pain with exercise, carry on. And sometimes that's quite helpful for the older athlete. And my last tip here is that as a practitioner, we need to back ourselves. So, we actually sometimes know more than we think, and most conditions will have better outcomes with good conservative rehabilitation and management than they would do with surgery. So these were meant to be 2 videos showing quite a high-level athlete combining her rehabilitation. The one on the right was where she goes into a backward lunge, and as she lunges backwards against this resistance of the CLX band, she comes into abduction external rotation. So she's a javelin thrower. So as she uses her lunge position to come back into the javelin position, we've given her a functional exercise to promote that. So again, when the athlete says, how much can I do at gym? How much can I do in training? Then I use this little quote and I say that practice doesn't make perfect. Practicing perfectly makes perfect. So you can do what you want, provided, again, no pain more than 4 out of 10 and no worse at 24 hours. But also, if your technique is perfect, then that you're going to get a much better effect and you're not going to have any pain from it. So if you're going to do a lateral raise, not my favorite exercise, but if you do a lateral raise like that, that's one thing. But if you do it by overloading and throwing yourself into extension, you're just going to overload your lumbar spine and your thoracolumbar region. So remember also that a lot of these muscle balances are also because you get what you train. So if you keep overloading the system, you are going to develop hypertrophies and imbalances that are sports specific. But also if you overload with poor technique, you are again going to develop dysfunctions that we need to identify and try and change that technique when you train. So for example, if you're a javelin thrower and you don't have glenohumeral lateral rotation range of motion, so your restriction as you come back is abduction external rotation, your give could be interthoracolumbar extension. And if you're giving interthoracolumbar extension because you don't have the shoulder range as you are training and throwing, the athlete will come to you with thoracolumbar back pain, not shoulder pain. So they get what they train. So you can improve the movement and release the pain at the back also using maybe manual therapy techniques. And you can increase the range of motion at the shoulder so that they no longer offload their back, but they also get what they train. And so they have learned an abnormal movement pattern. So once you've corrected the athlete and got the pain down and the restriction has improved the range, then you need to be involved in rehabilitation exercises that correct their technique so that they do no longer give interthoracolumbar extension, because that's what they've learned to do. So that's where you would use the coach, of course, to help you to retrain the correct technique that they can now do because they no longer have a restriction in range. So it sounds complicated, but actually it all makes sense practically, hopefully. So practice doesn't make perfect. Practicing perfectly makes perfect. So my tip number 9 is that we need buy-in and compliancy from the athlete. We need them to really want to work on their programs. And if they don't understand it, then, they're not going to be committed and motivated to perform the rehabilitation program. So to assist with this, you need to involve the athlete in the decision making. And sometimes also in that information stream, you need to include the coach, the manager, and possibly the parents, for example. And you need to set goals for that athlete, short-term goals, medium-term goals, and long-term goals, so that they know where they are in their rehabilitation program and they can see that there's a strategy and a plan and a positive end in sight. One of the top rugby players said to me, if it wasn't explained to him, he wouldn't understand that he had to do these small motor control stability type exercises in the early phases to get control around a region such as a knee or a shoulder. But once it's explained to him and he can see the end goal, then he's happy to be compliant and work with the physio and sports physician and so on. So tip number 10 is utilize the help of experts in their fields. So I'm a physiotherapist, so I need to try and involve and get a team event as much as possible. And a multifactorial problem often requires a multidisciplinary approach. So I might need to utilize the skills of sports physicians, psychologists, nutritionists, podiatrists, and so on. And I want to bring them into the management of this athlete. Now, however, bear in mind, certainly as the physiotherapist, often we are in environments where we don't have the backup of these type of practitioners, and we might have budgetary restraints or working with a team that just cannot afford these type of practitioners. So often the truth is, in some sort of rural areas or areas with poor resources, we often have to wear many hats. And so it helps for us to read and be as informed as possible. And perhaps then just get on the phone and just speak to someone that you trust to get some advice on how to manage these patients. But ideally, try and bring in as many experts in their fields as you can. And communication is everything. And I do love this picture. These are all these wise men of a village, and they are blind and they don't talk to each other. So the chap up here, he's feeling the top of the elephant. He thinks it's the ear is a fan. This chap's feeling the rough skin and thinks it's a wall. This expert here is feeling the tail and thinks it's a rope. And if they would all communicate and talk together, they'd all go, oh, it's an elephant, but they often don't talk. And so you want to surround yourself with practitioners that have the athlete's interests as their primary goal, and that you all communicate together to try and get the best outcome. And often just that communication can be very powerful. So my final tip is to listen to everybody really, but in particular for this talk, listen to the athlete or the sportsman. Be flexible and be adaptive. So you need to be able to modify your management of this athlete, maybe change the rehabilitation program as the signs and the symptoms change. Psychosocial factors such as stresses, anxieties, fears, they all influence your patient's response to your treatment and management and rehab. So we need to be very cognizant of this very large component of dysfunction. And remember that rehabilitation back to full competition is not only physical, but it's also often psychological. And again, we need to be cognizant of all of these to improve our outcomes with our treatment. So I'd like to thank you for listening to my talk on rehabilitation in sport, not one size fits all. If you'd like some more information on the exercises, you're welcome to have a look at grooviphysiosoftware.com, and you're also welcome to email me as well. Yeah, thank you very much.